All right, excellent. Well, welcome everyone. Thank you for arranging to spend time with us this evening. This is the virtual information session for the Post-Baccalaureate Pre-Health Preparatory Program at the University of Pennsylvania. My name is Jackie McLaughlin. I am the Director of the Pre-Health Programs at University of Pennsylvania, and we are joined by Faye McCoy, who's our Program Coordinator. Say hi, Faye. And Akila Abdul Rahman, who is one of our enrollment specialists. And both Faye and Akila will be answering your questions as we go throughout the evening. There is a Q&A section where you can put your questions in, and folks will be addressing them and answering them as I'm going through a brief slideshow. So the way I want to do this presentation is I'll start off with some slides, just giving you an overview of the two programs that we offer at University of Pennsylvania that are preparatory pre-professional programs for people who are interested in going to medical school, dental school, or veterinary school. And at the end of that presentation, you'll have opportunity to ask additional questions. So I'm just going to go ahead and get started. And as I go through all these slides with you this evening, I want you to think about, does what I'm describing in Penn's program sound like a really good fit for you, or are you looking for something different? It's important to understand that this is not a degree program. And whether and does that matter to you? Are you looking for a graduate degree or something different? Also, what kind of a program do you want? This is not what we call a cohort program. Everybody doesn't start at the same time, but all of your classes are with pre-health students. So we roster classes exclusively for our pre-health students at the University of Pennsylvania. And you have a very structured program with very structured advising. So it's not a do-it-yourself kind of program. We are not a certificate program. So although we do offer certificates of academic achievement to students who achieve certain benchmarks, but it is not, you do not get a certificate just for finishing the program. So these are some distinctions that you're going to find out there in the marketplace as you begin looking at different types of post-baccalaureate programs and figuring out what it is exactly you're looking for. I also want you to be thinking about how you envision yourself sort of fitting in and contributing to the community that we have here at University of Pennsylvania. So that's really important too. You know, you want to know what are the opportunities for me to engage with the university and with other students during the time that I'm there. So hopefully we'll give you some insights into that. All right, here we go. So what do we offer at the University of Pennsylvania? So the courses that we offer in our pre-professional preparatory programs are structured STEM curriculum with comprehensive wraparound services. So what does that really mean? So we have a wide array of undergraduate science courses that are available for students. They are rostered specifically for students in the pre-health program. We also individualize study plans for each of our students who are offered admission. And we have academic advising and career counseling for all of our students. We offer flexible timelines. So we have students who are following their study plan on a full-time basis, and we have students who are following their timeline on a part-time basis. And we help you plan that. Our interview is a very important part of that process for students to understand what kind of a study plan is going to meet your needs. We offer discounted MCAT prep course for students who are planning to take the MCAT for application to medical school. And in fact, that's going to get started. We'll have our orientation for that in just a couple of weeks. That runs from October through March. So students are prepared in April and May and June to take their MCAT for their application. We also have additional preparation workshops on how to complete these professional school applications, writing workshops, interviewing workshops, and other kinds of workshops that we add to the curriculum each year. We have a virtual online community set up through Canvas, where students can find all sorts of resources related to advising. We maintain a calendar of activities there on the community site. We do have some distinguished speaker events. We offer alumni panels and networking for students. There is a facilitated weekly journal club for students to dive deeper into the scientific literature. And we have also special student groups. So we have an overarching post-bac society. We're actually going to be doing elections for new officers this fall. And we have a variety of different special interest groups. The special interest groups tend to change each year based on what the interests of the student body are. We also have a peer mentor program. I'm in the process throughout September of assigning peer mentors to our new incoming students. And we have a peer education non-credit course on social determinants and health disparities. That's a lot. So there's a lot of comprehensive programming that's available here in addition to the courses that we help you to select and plan along your way. So the question for many applicants to our program is, which program is the right fit? The core studies program is what we refer to as a career changers program. Career changers are folks who majored in something maybe non-science. So you might have been an English major, or perhaps you were a psychology major, or we've had people who've been voice and music majors. But you didn't take all of those basic sciences that are typical prerequisites for professional school. And the other program that we have is specialized studies, and this is an academic enhancement program. Specialized studies students typically have done all the basic science coursework, but they are doing additional advanced undergraduate coursework, which is advantageous because it helps to bring up an overall science GPA and a BCPM GPA. And it also gives the students in this program more time to develop a research experience agenda to add to their application, to get additional clinical experience to add to their application. So it is often used to strengthen that application so that students can, present a strong application when they decide it's time to apply. So it's really important for you to evaluate which program seems to be the best fit for you in advance of your application. Our applications are submitted through Post-Baccalaureate, and in Post-Baccalaureate, you will see that you have to submit an application to core for a specific semester start or to specialized for a specific semester start. So it's very important to think about what's going to fit your needs best. Now, if you apply to one program and after we review your application, we think you might be a better fit for another program, I will often reach out to an applicant and ask if they would like to be moved to a different program. So we can do that. But I really think it's important for you to think, about when you're going to be ready to start and which program you think is going to be a best fit. A guideline that I like to give folks for helping to decide this is if 50% of the courses that you need to take are still in those basic core courses, like in biology or in physics or Gen Chem or Orgo and Biochem, 50% of those courses are in those areas, then you probably should be in the core. If you are beyond that, then, and you only have a few of those basic courses to take, then you can be a good fit for specialized. But we are available to answer questions about that if you're trying to decide which would be the best option for you. Akila is getting pretty well versed at helping to guide students through that, and Faye is as well. So when we look at the two programs, they are different in terms of the amount of coursework that is required to complete the program requirements. So the core studies program is 12 course units, and that's a minimum. And you will see here we list all the sequential introductory sciences and general chemistry and biology, organic chemistry, physics, and biochemistry. General chem, biology, organic chemistry, and physics are all laboratory-based courses. We also offer additional courses in the core program in physiology, cell biology, microbiology, histology. I throw calculus in there as well if someone needs a math credit. There's statistics or biostatistics. Most of our core students are taking 13 course units to 16 course units. The pre-dental students and the pre-vet students typically need to take some of these additional advanced undergraduate courses, and we're able to offer them through this program. And also important to know is that our classes are in the evenings during the fall and the spring. In the summer, we will roster courses all throughout the day in the evening hours. But if you are working during the day, you certainly may be able to take classes in the evening. But if evening, just doesn't fit your lifestyle, then, you need to realize that, this probably isn't the program for you. The core program does have prerequisites, and it's very important to understand that math mastery is expected in this program. I've listed here what we expect you to be able to do. This is also listed on our website. What we have implemented a few years ago is a college level pre-calculus course or higher is a prerequisite for admission to the pre-health core studies program. AP credit is acceptable as well, and it is defined, down there below and on the website. This is very important, and typically a prerequisite should be done, before you apply to the program. So if you apply to the program and you do not have the appropriate math prerequisite, you may not be eligible for the program or may not be offered an interview. So it's really important that you look at, your math background, ask questions whether or not you have the appropriate prerequisites. Sometimes if your application is early enough in the process, I'll reach out to students and they can arrange to take a qualifying pre-calculus course before the term that they would be admitted to the program. So we can work that out for students. But that means that you need to demonstrate that you've registered for a course, and you're going to need to provide a final transcript showing that you've been able to complete that course before you'd be able to register for any of your courses at Penn. The specialized studies curriculum is fewer courses. There aren't as many laboratory courses. The minimum is 8 course units, and many of the courses are listed here. Cell biology, histology, biochem fits into both programs. There are advanced cell biology courses, pathophysiology, molecular biology and genetics, cancer cell. There's a whole series of 7 human anatomy courses. We allow 1 course unit to apply to your program requirements, but you're able to take additional anatomy courses if you want to do that. Again, the classes are held in the evenings during the fall and the spring, And in the summer, we roster classes all throughout the day and evening. The timeline for specialized studies and for core as well is 2 years. So we typically allow any student who's coming into the program 2 years to complete their program requirements. Many, and I would say the majority of our specialized students are working. So most of them are part-time and they're taking 2 courses a semester and taking that 2-year timeline to complete. For our core students, a full-time in the core studies program is 3 course units. And most of our students are taking 3 course units. Core is next to impossible to consider being in that program if you're working full-time and think you need to continue working full-time. We advise students, at least when you start the program, to not be working at all, really. So again, that's important discussion for you to have with the interviewing team, members of the advising team, if you are offering an interview for the program, because you really need to plan ahead with what's going to work for you to get through the program successfully. So if you don't fit neatly into either one, which is a normal thing for many students, some students have had, well, I have a biology sequence, but I didn't have organic chemistry, or I had, chemistry, but maybe it wasn't the chemistry that I needed, and I need additional coursework, or I only had 1 semester of physics. What do I do? So again, you can ask us, reach out to us and ask us, use that 50% guideline there to determine how many courses of the basic prerequisite sciences do I need and which program seems to be the best fit for me. We also have an additional requirement called the Math On-Ramp. This is a program that we developed in-house to help our students have the math review that they need to be able to dive into the sciences. So if you have been out of school for a while, it's been a while since you've solved a quadratic equation and you can't remember how to do that, this is a great tool. So we do require the Math On-Ramp for all the core students, and then also any specialized students who might be taking any general chemistry or physics courses. This assures that you're all starting out the school year on a level playing field, and that you've seen the type of math that you're going to be able to be expected to use in your coursework. There's a small fee for the Math On-Ramp. It's $100, and that supports our in-house development and maintenance of the course to make it available to you. But you have to plan ahead for this one as well, because it's only offered in the summer. So if you're applying to the summer, that's great. You can take the Math On-Ramp along with your summer courses. If you're applying in the fall, you'll need to do the Math On-Ramp in the summer before you start your classes in the fall. Now, it is not a credit-bearing course. It does not take as much time as a credit-bearing course. It is fully online, and you can do the course. It's self-directed. You can do it any time of day from anywhere you are, as long as you can have, computer access. We did a survey of our students who completed this summer, and students, it took anywhere from a week to maybe 6 weeks for students to complete going through the entire course and finishing it. You have the entire summer to do it. We set timelines for you and benchmarks. So you should be through module 1 by this date. You should be through module 2 by this date, so that if you're a chronic procrastinator, you're not letting all of this work that you have to do on your own, go to the last minute. So again, it's just a review to help you be able to hit the ground running when you start in your science courses, because they are math intensive. How does advising work here at Penn? Well, we use an open advising model. So we have a team of 6 advisors to cover these 2 programs. And we have Danielle Lever, who is a full-time senior advisor for our program. She meets just about every student who's coming into the program and helps to develop your study plan. Your study plan is directed by input from the admissions committee, who, when they review your application, will make recommendations for what would be an appropriate part of your study plan. This is where you should start. So this is really where all things start, is with your first advising appointment. It's important for you to schedule that. We're not going to chase you down to schedule your first advising appointment, but before you're registering for courses, you should definitely have this first meeting. We also recommend that you schedule to meet with all the pre-health advisors in your first semester so that we all know you, because the pre-health advising team makes up the pre-health committee that is involved in the committee letter recommendations for students to medical school and to dental school. Okay. So our approach to advising is a collaborative process with the student. We're here to assist you and to optimize your progress towards reaching your goals. We don't tell you what to do, and we're not heavy on hand-holding. So we are supporting you and respecting you as an adult learner and helping you to move forward, not pushing you, but helping you to make decisions that are moving you forward. We provide realistic assessments and focus on facts that are going to lead you towards success. And we encourage your development in all aspects of decision-making, problem solving, and goal setting. We want you to grow while you're here. We're interested in your growth academically and in the extracurricular experiences that you're doing that are helping you to grow pre-professionally as well. I mentioned earlier the certificates of academic achievement. These are the criteria for students who meet these criteria. We will put a notation of the certificate on your transcript, so it will appear on your Penn transcript. We do have exclusive linkage opportunities. These are the linkage opportunities, the official ones that we are offering at this time. And our application deadlines are here. They're also on our website, and often Faye, I don't know if she put them in the chat, but she often puts them in the chat so that you have them there to look at as well. So that's it for my slides, and I'm going to stop talking, and we're going to go to questions at this point. I will stop sharing, and I'm looking to see where I can find and see if there are any Q&A. Okay, I see it now. Thank you. All right. So I have a question here that says, if I'm interested in applying to the core studies program, should I apply for a summer start or a fall start? And what's the difference? So that's a really important question for you to ask. And it depends on when you are ready to start courses. So if you think you have fulfilled everything that you need for the core program and you'd be ready to start in May, then a summer start might be fine for you. If you're planning to graduate, so what we run into sometimes is students are graduating in their senior year, and maybe they're not graduating until after the start of our summer session. Well, if those dates overlap like that, then you have to apply to the fall. You're not ready for a summer start because you have to have a bachelor's degree before you can start in a post-baccalaureate program. So that's something to consider. There are other things as well. So basically, it's the same courses that students are taking. It really is about your readiness. Now, International students have to start in the summer because they have to be full-time and they have to get through all their coursework in 3 semesters. That is not the typical timeline for our students because it tends to be really an overload. So there is a 1-year timeline that with my approval, prior approval, a student could start in the summer and move through coursework in that timeline, but that's an exceptional student who would be able to do that. So, and the only way to do that is with a summer start. Most students start in the fall. And that's our typical timeline. They start in the fall with 3 course units and take 1.5 to 2 years to move through the core studies program. When picking core or specialized, what would you recommend applying to if you are pre-med and have taken all the typical classes but did not do great? That's also a really good question. So when you say you didn't do great and you have a 3.2, that gives me 1 point to be able to assess. But if you have courses that you're thinking of repeating, so that is if there's anything that you got a C- or a D in, and if you're considering repeating those courses, then you might be somewhere in between. I don't know how many courses, if that's the case in this situation, how many courses they would be. You would be probably best applying to the specialized program and then having that discussion with us. And if we needed to move you to the core because were just, many courses that you wanted to repeat or needed to repeat, we could do that. We don't recommend that students come here, though, to repeat courses that they did in their undergrad unless it's necessary to do that. That's not what this is. So some students may think, oh, I want to just redo that whole core. No, that's not the right program. We want you to advance and go forward. We can have those discussions, though. It is a very good question. What are the chances of getting into a linkage school and what % of the class applies and is accepted? Almost all students, not everyone, but almost all students who apply to a linkage school are accepted. But we have very few students who apply to linkages. So we don't have tons of linkages to manage. We only have a handful. And those linkages take, a few students. They have spots for a few students each year. So we might have anywhere from 3, 5, 9 students who are applying linkage in a year. And as I said, most of those students are accepted when they apply to a linkage program, but not all of them. So we do a lot of work with students before they consider applying to a linkage program to see whether or not linkage is a good fit for them. So initially, some students think it would be great because it eliminates that glide year, but it may not be. The timeline requirements for that partner school may really not be a good fit for that student. So there's a lot to consider in deciding whether or not you want to apply for a linkage. Okay. Does specialized program require an MCAT? No, we do not. It require an MCAT to apply to our program. We do require specialized test score. And that is typically for most people an SAT. We just need an SAT. If you don't have an SAT or an ACT, if you don't have an SAT or an ACT, then you would take the GRE. We don't want you to take the MCAT until you're prepared to take the MCAT and ready to be applying to medical school. Okay. If you already have an MCAT score or a DAT score, then by all means, you're asked to include that as part of your application. In terms of our interviewing, we're going to want to understand how you prepared for that. So there's a whole lot of discussion that goes on around that as well. But no, we do not want you to take an MCAT or a DAT specifically to apply to this program. Is a student who's currently a biology major able to join this program or any of the other ones? Well, there are only two, so it would be core or specialized, and it seems that someone who's a biology major would be a good fit for the academic enhancement program, which is the specialized studies. So in general, that would be the appropriate program for you. Are the linkages only for MD or can they be for MD PhD? We don't have any MD PhD linkages. That would be unusual. But we will advise you on MD PhD preparation. And it may be that if you are admitted to a school as a linkage applicant to that school, usually in the first year of medical school, in the very first weeks of medical school, they will roll out their dual degrees, and you may be able to add on a dual degree or, other advanced degree at that time once you're already enrolled in a program. So, yeah, there are lots of ways. I often say there's more than one way to sort of skin a cat. So there are lots of ways to get to the end point where you want to get to. But it's great to have discussions around that as well. Does the average student take 1 year or 2 year in each program? So most of our students take 2 years in each program. It's much easier to do a 1 year in the specialized than it is in the core because it's fewer courses and they're not laboratory courses for the most part. So it's very possible to do 4 courses in the fall and 4 courses in the spring if you're not working. Okay. But it's very difficult to do the core in 1 year, although it can be done with a summer start, but you need permission to be allowed to do it on that timeline. How common is it for students in the core studies program to complete the courses in 1 year? I think I just answered that. And what qualifications does that exceptional student have to have? Really high GPA and really high standardized test scores is a really good beginning point. There are other things that go into determination of whether or not a student is prepared to do that. But as I said, it's an overload, academic overload. It also depends on what experiences you've had. It requires a conversation with me about whether or not you would be a good fit if you are invited to interview to the core program. Okay. Is there a minimum grade requirement for pre-calculus? So if I understand your question, if you took a pre-calculus course, is there a minimum grade that you have to qualify to meet the prerequisite? Well, typically a satisfactory grade. So typically anything above a C would be would meet the requirement. Anything really lower than a C probably isn't going to meet the requirement. It might depend then looking at what other math you've had, what your standardized testing is showing in terms of math to determine whether or not, a grade lower than a C would be acceptable in a pre-calculus course. So there are lots of things that go into, making those determinations. It's not so much, you get this score and that's it. Generally a B or better is what we look for. Okay. That gives us an indication that you have been able to do the material, you understand the material well enough to be able to move forward with the coursework. I'm an international student, but I don't need an F1 visa since I'm on OPT. This will allow me to complete the program as long as no degree is awarded, which applies to this program. Is that okay? Well, how long are you on OPT? So what is the timeline that you have available for OPT, and which program are you talking about? The specialized program? So I'm not really sure. I can't give a specific answer to that, but we'll probably circle back to that. What if I apply to a linkage but take a gap year in between? Well, then there's no reason to apply to a linkage. So the only reason to apply to a linkage is to matriculate in the year that you've been offered admission. So, and there are many hoops to jump through for a linkage, so there's no reason to go through it if you're planning to take that year in between, which is your glide year. It's not a gap year, it's a glide year. So the normal application process to medical school or dental school is a year-long process. So the linkage just is a different way that students are admitted in the same year that they apply. So there are only a few seats available in any institution for students to enter that way. But yeah, no, there's no reason to be throwing your hat in the ring to enter into the same year you're applying if you're planning that you're going to be using that additional year for some research or something like that. Do you accept ACT super scores, or do we have to submit each? We need an official score report. We will oftentimes look at a super score, but we want you to submit an official score report, which will show the individual test scores. And that's really interesting. So if you have a lot of variability across your subjects in the times that you took the test, that'll be interesting. So we'll look at that in relation to everything else that we see as part of your academic record. But yeah, so you just submit the official, test score report, and we figure out what information that's going to tell us. We don't base admissions decisions on a standardized test score only. We do holistic admissions reviews, and the standardized test scores are just one data point that gives us some information to look at and consider in an applicant. Part-time students also need to finish the program in 2 years. Yeah, and that can be done. So for each program, the core studies or the specialized studies, they can both be completed successfully in a 2-year time frame or less. But if there's extenuating circumstances, then we need to extend that a little bit for a student. That is a discussion that we can have, because there are situations where, a student might stay for an additional semester or take a time out and come back to their studies. So there are all sorts of exceptions to that, but that is the norm. Okay. How are students for linkages selected, and how does that process work? We hold a workshop every semester for students who are interested in linkage. And Danielle runs those workshops and runs through our linkage options. And then students evaluate whether or not, this sounds like a good fit for me or not. And then you go through an application process. And you submit an application, and then you interview with members of our advising team. And we evaluate you based on your application and your preparedness for application to that particular school. And we'll have conversations with you about it. And if we think you're not a good fit for that linkage program, we'll talk to you about that too. So we tend to be pretty transparent, and our goal is to help you be successful. And if we don't think that's going to be a successful option for you, we will work with you to look at different ways to look at how you're going to approach your application. Okay, what would this program be a good fit for someone? Oh, would this program be a good fit for someone who has returned to school later in life, graduated, then wanted to obtain or repeat some yeah. So we have a lot of students who are older, they've graduated, they've been working in the field, different field, whatever, they have different life experiences. Some do come back if they have maybe did all that core coursework, and maybe it's 10 years and they haven't been working in a science field and using that. So they do want to come back and repeat all those courses. So yes, in that kind of case situation, students could do the core in all those courses. So, or some may be rusty in some area and want to come back and refresh with a couple of courses instead of doing the whole entire core. So it's really interesting because we do so much individualization and tailoring. I think everybody's background and life experience is different in these programs that we offer. And we spend a lot of time and invest a lot of time into getting to know the students and guiding them in what those best options are for them based on the goals that they have. Okay. If we apply early, can we receive results sooner? I'm not sure how to answer that question. Maybe you could rewrite it, give me a little bit more specific information, what program you're considering, and by applying early, we do have an early decision deadline, so you can look at that because that is detailed, but and the results, you do get your either acceptance or rejection for the program on a little bit earlier timeline with that one. So I'm not sure if that's specifically what you were asking. Should the standardized test have been completed within a certain time frame? No, the time frame doesn't really matter. Yeah, 5 years ago is fine. They don't expire. It's not like MCAT scores or DAT scores where for admission to professional school, they do expire after a certain time frame. No, these standardized test scores don't expire. So they're just giving us a point in time, okay, that we're using as a piece of the entire application that we're looking at. Is it common to participate in research while completing the course studies program, and what does that look like? Many students do complete research and do some clinical experience while they are in the core program. We encourage students to do that because oftentimes the core students don't have that type of experience. It looks different for each student, but we have actually a partnership with a program called the Academic Associates Program at the clinical settings at Presbyterian, at Children's Hospital, and at the Hospital of University of Pennsylvania, where students work 6 hours a week and learn about protocols for clinical research and actually begin recruiting patients into studies and so forth and so on. So you're getting patient interaction, you're working in a clinical setting, you're learning about that, you're getting exposure to research, but it's very limited, okay? And it's unpaid, but it's great experience. So from there, it's a stepping stone. The other thing is that limited amount of time fits well into a program like the core studies program where you don't have much time. 6 hours a week is probably all you have outside of your coursework, okay? Any students apply to other programs such as a DPT, a doctorate in physical therapy? Yes, students do. I haven't seen a physical therapy application in a couple of years, but we have had students do that. So you want to ensure that whatever program you're interested in, and we will support you with that. So sometimes a student will come into our program and they're torn. Well, I think I want to go this direction, but I'm also interested in this direction. Oftentimes we see it between medicine and dentistry, or we've seen it between medicine and veterinary medicine. I really want to be a vet, but I'm really drawn, to this human medicine aspect now. So many students are still in a process of discernment when they come into our program. And that's exactly what you're supposed to do, is gain experience, process it, and determine which is going to be the right direction for you. And we help to guide you with that. So if physical therapy would be the right direction for you, or that in before even coming here, you want to make sure that you look at the courses that we're offering and that you can get the courses that you need here, right? There's more discussion that, we can have about that. But yes, we support students going in different professional directions, but the majority of our students are going into medicine. And then we have smaller handfuls going into dentistry and into vet school. And then it's an occasional student who decides they're going in a different direction. How does this post-bac differentiate from other post-bacs? So that's your homework to do. So what you want to do is look at many post-baccalaureate programs that are out there. They're all very different. Ours is offering undergraduate courses. Ours is a preparatory program, not a certificate program. The reason we are a preparatory program is so that students who have room to borrow on their federal loans, on their undergraduate record, can borrow federal loans. In a certificate program, you cannot borrow federal loans. Where, we offer flexibility in terms of timelines, a lot of, flexibility, depth and breadth in offering of courses that you can't get in a lot of other programs. So, it really depends. You have to pick a few and dig through and take a look at them. I'm not an expert on everyone else's program, but I am an expert on ours. So I'm not going to, give you specifics about someone else's program because that wouldn't be fair. So you're going to have to, there are lots of resources out there that you can look at. AAMC is a good place to start and take a look there and do exactly what you're doing here. Go to information sessions and ask questions. Okay. May I ask, what does the research and clinical experience to make you a stronger applicant in specialized program look like? Exactly that. So it depends on what you need. So if you are a student who doesn't have any preclinical experience, patient interaction, then we're going to recommend that you identify opportunities to do that during the time that you're enrolled in this program. Students will leverage the proximity to those clinical settings on Penn's campus while they're here. So what research looks like and what clinical experience looks like for each student is different. You just need to get some feedback on what your experience looks like when you're coming in and how you can enhance your application during the time that you're here at Penn to help you build a strong application. Okay. Do we need to send official score reports from the ACT directly to Penn, or I'm sorry, they jump around here. So is self-reporting on post-bac CAS okay? I was trying to find that answer on your website, but I didn't get a clear answer. I believe that I don't really recall exactly what they're doing with the score reports. I think we're asking for official score reports. And we're asking for that score report to have your name on it. So when you present a score report, we should have the identifying information that this is actually your score report that's being presented as part of your application. If when you submit your application through Post-Baccalaureate and it gets to our Penn admissions team, and if there's something that's missing from your Post-Baccalaureate application, they'll reach out to you because they go through those applications and there's a checklist that you follow to make sure that I have everything in place. But our admissions team will reach out to you and work with you to help get your application complete if it's missing anything. Okay, so I feel like I've been talking nonstop for an hour, but I think that we've answered a lot of your questions. If you find that you have additional questions, please again, comb through our website, send emails to our enrollment specialist, and we'll do our best to get your questions answered in a timely way. I want to thank all of you for joining us this evening. I hope you got something out of it, and I hope to see your applications soon. Thanks a lot.